To the coronavirus recovery now, as the Delta variant becomes more widespread, cases in LA County are climbing. The health department is reporting a 165% rise in cases from last week, part of that attributed to a holiday backlog. Still, Southern California has been hit hard since the pandemic began. Our I-team found counties here have 4 times the death rate compared to San Francisco, and those who lost loved ones are now questioning what could have been done differently to save them.
I was very shocked. I mean, I still cry to this day.
Don't let it take you. Don't give up on it. He says, I can't.
72-year-old Morris Mendoza died 6 months ago from COVID, leaving behind heartbroken family and friends in Riverside, a county where the virus claimed 210 lives for every 100,000 people during the pandemic. That's one of the highest COVID death rates in California. The I-team crunched the numbers from the Centers for Disease Control and found Los Angeles and San Bernardino counties have even higher death rates. 228 deaths per 100,000 in LA, 258 in San Bernardino. Compare that to San Francisco, which saw just 57 deaths per 100,000 people.
There are many differences between Southern California and Northern California in terms of demographics, in terms of big issues like social vulnerability, which have to do with the level of poverty, the number of people who are living in close proximity to each other.
And UCLA epidemiologist Dr. Anne Ramoyne points out San Francisco and the rest of the Bay Area were the first in the state to implement strict stay-at-home orders. All 10 counties there show fewer than 100 cases per 100,000 people.
There was a lot of compliance with social distancing, masking, and other measures.
LA County implemented strict stay-at-home orders too, but of the 10 million people here, 1 in 5 lives in poverty, a key factor when considering a community's social vulnerability and heightened risk to a virus like COVID-19.
So what we saw was the virus really running through these populations. And when you have multi-generational households, you have younger people who are working, and then they bring it home to their families. And we saw a lot of that here.
And many of the communities hit hardest by the virus have also had accessing the vaccines.
He could have still been alive if we had the vaccines available here in the community back then.
Cindy Mendoza Collins says the virus that took her brother's life almost claimed hers as well.
It was awful. The worst month of my life. I thought I was going to pass away too.
She is now fully vaccinated and hopeful the loss so many have endured will lead to meaningful change, a sentiment echoed by Dr. Ramoyne.
I think that it's really important to remember all of the hard work that was done to get through the surge and to the other side of it. And to continue on a trajectory where we are saving lives.
Saving lives by continuing to slow the spread and never forgetting those like Morris Mendoza who lost their life because of COVID. And keep in mind, COVID is spreading primarily among the unvaccinated, and every time it jumps to another person, the virus has the ability to mutate again, and that could create an even more transmissible variant than Delta.